This video demonstrates how to set up and use the Ballard Liberator closed suction system and the bronchoscopy BAL adapter. The Ballard Liberator closed suction system features a manifold with a stopcock that enables uninterrupted ventilation during catheter or bronchoscopy adapter changeout. Before beginning the procedure, wash your hands and don appropriate protective equipment, per your hospital protocol. Non-sterile gloves are okay. Obtain the correct catheter size with attached manifold. AARC clinical practice guidelines suggest that the catheter should occupy no more than half of the inner diameter of the artificial airway. Remove catheter from packaging and attach the flex connector, if necessary. Attach catheter to the suction tubing at the thumb valve. Depress and hold the thumb valve and adjust the vacuum regulator to the desired level. Most experts suggest a negative pressure of 80 to 120 mm of mercury, or -10.7 to -15.9 kilopascals. Release the thumb control valve and attach the catheter and manifold between the patient and the ventilator circuit. Make sure that the stopcock is turned off to the suction catheter and in the ventilator-only position. To begin the suction procedure, rotate the stopcock to allow suctioning. Next, stabilize the catheter and the ET tube adapter with one hand. Then, with the other hand, advance the catheter into the ET tube using your thumb and forefinger. Align the printed depth number on the catheter with the similar number on the ET tube to know when you have reached the distal end of the ET tube. Once the catheter has been properly positioned, the centimeter marking on the catheter that is visible through the irrigation chamber can be noted and used for subsequent suctioning procedures. To begin suctioning, rotate the lock on the control handle if required and then depress and hold the thumb valve and gently withdraw the catheter. Use intermittent or continuous suctioning technique, according to your hospital protocol. It is recommended that the entire suction procedure last no more than 15 seconds. Stop withdrawing when you see the black ring inside of the catheter sleeve and then release the thumb valve. Perform catheter irrigation. To do this, ensure that the stopcock is close to suction and in the ventilator-only position, and then open the cap to the irrigation port. Twist open the 15 ml saline vial and insert into the irrigation port. Intermittently depress and release the thumb valve until the catheter and chamber are clear, or until the saline vial is empty. Remove the saline vial, discard, and replace the cap on the irrigation port. Lock the thumb valve to prevent inadvertent or accidental suction. To do this, lift the green part of the thumb valve and rotate 180 degrees. Repeat this action to unlock. Apply the appropriate day sticker to the thumb valve. As an example, if the catheter is opened on a Monday and intended to be replaced in 72 hours, place the Thursday sticker on the thumb valve. Place the suction tubing and the catheter out of the way. When using this system for procedures such as bronchoscopy or mini BAL, utilize the Ballard Liberator accessory adapter for BronchBal. Before beginning the procedure, wash your hands and don appropriate protective equipment, per your hospital protocol. Make sure that the stopcock on the manifold is turned off to the suction catheter and in the ventilator-only position. Carefully disconnect the catheter from the manifold by rotating counterclockwise. Remove the cap from the adapter and place on the closed suction system. Set the closed suction system aside. Carefully connect the accessory adapter to the manifold by twisting. Open the cap on the adapter, insert bronchoscope or mini BAL catheter into the accessory adapter, and then rotate the stopcock to open the manifold to the device. Advance the bronchoscope or BAL catheter as needed and perform the procedure. Once procedure is complete, withdraw the device until the tip is visible proximal to the stopcock. And then rotate the stopcock back to ventilator-only position. You may now remove the device from the adapter, disconnect the adapter from the manifold and dispose of it properly. Remove the cap from the suction catheter and reattach the catheter to the manifold. After 72 hours, replace the closed suction catheter with a replacement catheter without manifold. The manifold is intended to be changed PRN, but not to exceed the life of the ventilator circuit. The Ballard Liberator closed suction system is compatible with the Ballard Liberator ET tube clearing system.